Hello and welcome to Cardiology 101. This is Dr. Shiraz and today we're going to talk about premature ventricular contractions and premature atrial contractions. As the name indicates, these are the premature beats that come in between the regular heart cycle or the cardiac cycle. So for example, if we have a regular beat, it is the continuity of P wave, then QRS complex, then T wave, then it has a regular interval between the T wave and the P wave, and then the QRS complex repeats itself. But in the case of premature contractions, these are the beats that originate in between the cardiac cycle. Before a cardiac cycle is completed, another beat is generated that is called premature beats. So based on the origin, whether it originates from the atria or the ventricles, it would have different than normal morphology of the P wave or the QRS complexes. So it occurs in between cardiac cycles. All right. On the basis of origin, it can have a different P or QRS are followed by resting period. So what is a resting period? So when we know when a heartbeat or the electric potential of the heart completes itself, the heart goes into a refractory period in between which no beat can originate in the heart. So when premature beat occurs, it is not followed by a normal beat instantly. Rather, there is a pause in between two beats. That is called the resting period. All right, that gives the feel of missed beat. If you check the pulse of a patient with the PVCs, you will feel that they skip a beat or they miss a beat. And the patient will come to you in your OPD or in your hospital and they will say that they feel this funny feeling inside their chest where they are missing beats. Those are premature ventricular contractions or premature atrial contractions. So why these are important? These can occur in anxiety. In fact, the number one cause for these premature beats are anxiety, excessive intake of coffee or other energy drinks, lack of sleep, and other these kind of things. But once my professor said, if a patient comes to you with PVCs, the first thing you should rule out is ischemia. And you will see in post-MI stages, when a patient is recovering, you will see that there are PVCs originating in those patients. So it is very important to differentiate that these PVCs are not the result of ischemia, rather they are normal. So first of all, let's talk about the PVC. These are one of the most common arrhythmias or abnormal findings in the ECG, and you will see them a lot. So if you look at here, this is our normal beat, all right? This is T wave, this is P wave, then again a QRS complex, a T wave, but then we see this bizarre shaped wave, all right? This bizarre shaped complex that is not following a P wave. There is no P wave following a T wave. So this is our indication that this beat is premature. And if you compare this beat to other complexes, you will realize that it is bizarre shaped. It has broader QRS complexes. Its direction is different than other QRS complexes. It has disconcordant STT changes. What are disconcordant STT changes? We have talked about it in our previous lectures, and if you haven't watched those lectures, I really insist that you should go there and watch it. So the direction of QRS complex and the T wave is opposite to each other. This is called disconcordant STT changes. All right. So what we see is a broader QRS complex. Why it is a broad QRS complex? Because we have talked about the ectopic beats or ectopic foci in the ventricles generate beats that have broad QRS complexes. We have seen this in ventricular tachycardia. We have seen these in premature ventricular contractions, and we have seen those in ventricular fibrillation. All right. So if you look closely after that premature beat, there is a resting period in between. There is no normal QRS complex. All right. So we have this ECG with us. We can see that lead 1, lead 2, lead 3. We see that a normal QRS complex is followed by a T wave, and then there is a premature beat. All right. There is a premature beat. Similarly, we can see that in AVR. So if we look at lead 1 here, it is given as a continuous lead. We see that a P wave, then a QRS complex, then a T wave, and then T wave is followed by a PVC. So we see that a normal QRS complex is followed by a PVC. This pattern is also called Bigeminy because every other beat is a PVC. This is more prominent in the anterior leads. if you look at the anterior leads, a normal beat whose amplitude is more towards the negative side, but the PVC has amplitude more upside. It is coming prematurely and it is broad QRS complex and it has disconcordant STT changes. So this is our PVC. Next up, we have again an example of PVC. You will see that after two normal beats, we are seeing a PVC which has disconcordant STT changes and a broad QRS complex. And it is followed by a compensatory pause or resting period, and then again a normal cardiac cycle repeats itself. So if we look at this example, if you look at lead 2, all right, can you count how many PVCs are there in this lead? I would say 1, 2, 3, 4, 5. Every PVC is coming after two normal beats. 1, 2, and then PVC. 1, 2, and then PVC. So every third beat is PVC. This pattern is called trigeminy. Alright. Moving forward, we have premature atrial contraction. As the name indicates, the ectopic beat that generates in this abnormalities from atria. So you know that the wave we have by the repolarization or the depolarization of atria are the P wave. All right. So in this example, we will have a beat that would have P wave, that would have QRS complexes, but it would be coming prematurely, and the morphology of the P wave would be different than the normal morphology of P wave. So if we look at this example, we have a P wave, then a QRS complex, a T wave. Then if you look at this P wave, you will see that it is different from the rest of the P waves. All right. So this is our sign of premature atrial contraction, and then you will see that the QRS complex is of normal shape. So this is how we differentiate premature atrial contraction from premature ventricular contraction, that it has normal QRS complex and it also has P wave, which is different in morphology. These two are coming prematurely and they are followed by a resting period. All right. Can you identify another PAC in this ECG? Yes, this one, because this has strange pattern of P wave and it is coming prematurely. Well done if you guessed it right. If you look at here, we have this P wave that is looking very weird, and then this P wave is looking weird, and this P wave is looking weird, and then this P wave is looking weird, and so on and so forth. These are our premature atrial contractions. So if we take this continuously, if you look at this P wave, 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 these all look similar. But if you look at this P wave, you will see that it is taller than the rest of the P waves, and this beat is also coming prematurely. This indicates that this is our premature atrial contraction. Alright, similarly we can see here that this P wave is taller than the rest of the P waves, and then it is followed by a QRS complex that is different in shape than the rest of the QRS complexes. So this is our premature atrial contraction. Thank you so much for tuning into this lecture. If you have any query, comment it down below and I will be happy to respond to them. And take care. I will see you in the next video. Thank you.